Hello, everyone. This is Dr. Steve Farrell from the Cooper Institute in Dallas, Texas. And today I'm going to be speaking with you about a recent paper, the association of the omega-3 index with incident prostate cancer with an updated meta-analysis. This is the Cooper Center longitudinal study. So in terms of background, most of you are probably aware that prostate cancer is the second leading cause of cancer death among United States men, with an annual mortality of approximately 32,000. There are also about 175,000 new cases of prostate cancer diagnosed in U.S. men each year. We know that in many types of cancer, including prostate cancer, that inflammation plays a role. And there are lots of different lifestyle factors as well as medication that can have an effect on inflammation. And these would include things like obesity, poor diet, physical inactivity, which would tend to increase inflammation, and medications such as statins and aspirin that tend to decrease inflammation. Over the last 30 to 40 years, there's been an enormous interest on long-chain omega-3 polyunsaturated fatty acids, which are also known as fish oils, which we find primarily in cold water fatty fish such as salmon, as well as dietary supplements. And among the effects of these long-chain omega-3 polyunsaturated fatty acids is that they tend to have an anti-inflammatory effect. So there have been a handful of studies regarding omega-3 status and incident prostate cancer. The results of these studies are somewhat inconsistent. This may be due in part to the very questionable validity of dietary questionnaires. In other words, when you ask people what they eat, they may or may not give you correct information. About 15 years ago, Harris and colleagues developed the omega-3 index, which we're going to abbreviate O3I from this point forward. And this is a blood test that provides an objective measurement of blood omega-3 polyunsaturated fatty acid levels. And in terms of units, we express the omega-3 index as a percentage. And it refers to the percentage of fatty acids in red blood cell membranes that are composed of eicosapentaenoic acid, or EPA, and docosahexaenoic acid, or DHA. There are currently three categories for the omega-3 index. Less than 4% is considered low, between 4 and 8% is normal, and an omega-3 index of greater than 8% is considered optimal. So our primary purpose in this study was to simply examine the association between baseline omega-3 index and incident prostate cancer in a large sample of healthy men. And the secondary objective was to add our findings to an existing meta-analysis on this topic. We took 5,607 apparently healthy men who underwent comprehensive physical examinations at the Cooper Clinic in Dallas, Texas, on at least 2 occasions between 2007 and 2019. Fasting blood samples were taken and analyzed for the omega-3 index as well as many other factors. Now, we define prostate cancer incidence as men who reported no prostate cancer at the baseline exam and a new diagnosis of prostate cancer at one of the follow-up exams. So just a little bit about our sample. The men were just over 53 years of age on average. Their mean PSA at baseline was 1.1 nanograms per milliliter, perfectly normal. And their baseline omega-3 index was 6%, which is also in the middle of the normal category. During an average follow-up time of just over 5 years, 116 new cases of prostate cancer were identified. And again, we examined the risk for prostate cancer using the omega-3 index as both a categorical and as a continuous variable. So in this figure, we're looking at the omega-3 index as a categorical variable. Again, there are three categories on the x-axis: less than 4%, 4 to 8%, and greater than 8%. And on the y-axis, we have the hazard ratio for incident prostate cancer. Now, this hazard ratios have been adjusted for age, baseline body mass index, and baseline PSA values. And using the low category as the referent, we see a trend toward decreasing hazard ratio across the three categories of omega-3 index. But you'll notice that we have very wide 95% confidence intervals in the normal and high categories. So although this trend goes in the right direction, it is not statistically significant. Therefore, when using the omega-3 index as a categorical variable, we find no significant association between baseline omega-3 index and subsequent prostate cancer risk. When looking at the omega-3 index as a continuous variable, we found that for each 1% increment in the index, the hazard ratio for incident prostate cancer was 0.96, with a 95% confidence interval between 0.87 and 1.06. So again, this is a non-significant finding because that 95% confidence interval includes 1. If we were to word this in a different way, we would say that we found a non-significant 4% decrease in the risk of prostate cancer per 1% increment in the omega-3 index. So using the omega-3 index as both a categorical and a continuous variable, we found no significant association between the index and subsequent risk of prostate cancer. In this figure, we've simply added our data to an existing meta-analysis, which was performed by Fu and colleagues in 2015. Now, this particular meta-analysis did not look at the omega-3 index. It looked at EPA and DHA separately. So in the upper half of the figure, we see the hazard ratios for EPA, and in the bottom half of the graph, we see the hazard ratios for DHA. And you'll notice that the hazard ratios are hovering right around 1.0 with very wide confidence intervals. So in adding our data to the existing meta-analysis, our overall conclusion here would be that there's no significant association between blood levels of EPA or DHA with subsequent prostate cancer risk. In terms of the strengths and limitations of this study, we had a large sample size of apparently healthy men. And again, we were able to objectively measure omega-3 status rather than relying on questionable dietary surveys. But one limitation we always have in the CCLS is that our sample is mostly white. About 93% of the men in this particular study were white. And these men have a relatively high socioeconomic status. Many of them are executives. Most have a college degree. We also had a relatively short follow-up time of about 5 years, and we would also consider the self-reporting of incident prostate cancer to be somewhat of a limitation. However, due to the high socioeconomic status of these men, we're very confident that they're accurately able to report various conditions. So in conclusion, we found no significant association between baseline omega-3 index and incident prostate cancer. The trends were in the favorable direction, but not statistically significant. So we recommend that healthcare professionals should continue to encourage their patients to consume 1 to 2 servings of non-fried fatty fish per week, as recommended by the American Heart Association, without being overly concerned regarding an increased risk for prostate cancer. Thank you for your attention.